And with the Ebola patients' arrival in Atlanta, they will be just 3 hours from the mountains.
News 13's Karen Wynn spoke with a couple of local healthcare workers, including one missionary. Karen, what are they saying?
Darcel, they understand many will find the infected people a little too close for comfort, but both say we have nothing to fear.
The transmissibility is so high.
Local doctors understand why some may be afraid of Ebola patients being treated just a few hours away.
About 50% or even more of the patients who get infected with the virus will actually die. So I think from that point of view, fear's a very rational and understandable thing.
But Hathaway says we should not fear Ebola patients being treated at a top hospital under the watchful eye of the Centers for Disease Control.
It's not at all likely that there'll be any cases up here. It's exceptionally unlikely that there'll be any transmission from that patient in Atlanta to any other patients if they take standard precautions.
Dr. Lawson of Sisters of Mercy agrees.
The most dangerous patient is the one when we don't know what they have.
Lawson has done medical missions since the 1970s. She says the American doctor and nurse who have Ebola may have gotten it from someone they didn't know had it, since it can take up to 21 days before developing symptoms. Both doctors say the patient's chances of survival will go up in the U.S., citing the lack of hospitals and some cultural barriers overseas.
In some of these Western African countries, they're even afraid to say the word Ebola because they think that'll create transmission of the virus and creation of the virus.
Dr. Lawson, who worked in the Congo for 2 years, has caught malaria and dysentery during her travels. As she prepares for a fall mission trip to Haiti, she understands the Ebola patients' passion that put them in harm's way.
I love getting to know people of different cultures. I enjoy studying different languages, and the people are so grateful. We always feel we receive much more than we could ever give them.
And Dr. Lawson says that she hopes the Ebola outbreak does not discourage doctors and nurses from traveling to provide medical care where they are needed.